Hey everyone, it's Dr. Keys. Welcome to the Keys to Confidence podcast. I'm here with Shauna, my wonderful office manager, and we are excited to chat about all things skin, beauty, health, wellness, and to help unlock your inner confidence. If you have any questions you would like me to answer on future episodes, send us a DM on Instagram at KeysMD Cosmetic Clinic or email us at info@keysmd.ca, and I'll try to answer as many as I can on upcoming shows. If you like what you hear, don't forget to share and subscribe so that you never miss another episode and to help us grow. Now let's get started.
Welcome to another episode of Keys to Confidence. I'm Shauna. How's it going today, Dr. Keys?
Doing well. I'm doing so much better than last week, as I'm sure you remember with my man cold.
Yes, you are very dramatic.
Yes, I am on antibiotics and I'm recovering, but that was a rough couple of days for sure.
I'm glad to hear that you're feeling better.
Yeah, absolutely. I'm pretty much back to 100% and ready to get this week going.
I'm really excited to talk to you, Dr. Keys, about PRP. This is a treatment that many people may not know or have heard of. What is PRP?
Yeah, PRP stands for platelet-rich plasma. It is blood that's naturally enriched with concentrated platelets to promote and regenerate healing and rejuvenation. So the blood is made up of several different parts. You have the plasma, you have white blood cells, red blood cells, and platelets. And the platelets are vital proteins that promote cell function and immunity.
That's super interesting, Dr. Keys. How is that used?
Well, platelets have a lot of growth factors within them. So then you use these growth factors to trigger healing in different parts of the body. So take, for example, if you cut your arm, platelets will come in and form clotting first to stop the bleeding. And then they release the growth factors to send out signals that say, hey, we need to repair this tissue. So they influence the surrounding cells to do different things and promote healing. So we try to take advantage of the healing response with the platelets that are in PRP.
So for both medical and cosmetic purposes, PRP can help promote health and healing.
Yes, absolutely.
Amazing. How do you get PRP?
So PRP is first we draw blood from the patient's arm, and then it's processed in a machine called a centrifuge. This separates the blood into components into three parts. So you get the platelets, white blood cells, and red blood cells. And when you see it after it's taken out, it's completely divided. So you'll see red at the bottom with the red blood cells, and then you'll see the yellow color at the top. And that's why PRP also has the name liquid gold, because it's gold in color. So then these concentrated platelets are extracted and combined with remaining plasma and injected into the affected area. So it's minimally invasive, it's non-surgical, it's just a needle procedure, which enhances healing with the body's concentrated body bioactive factors.
And it's obviously very safe with minimal downtime and very few side effects.
Yeah, there's almost no side effects to it, which is great. It's been around for almost 30 years. It's been much more mainstream over about the last 10 to 15 years. And yeah, patients can resume normal function immediately after.
So what are the different uses of PRP and how is it helpful?
Yeah, PRP can be used for several different things. So we often use it for microneedling. So whether it's just regular microneedling or radio frequency microneedling, it can be used after. Same with ablative laser treatments or even fractionated laser treatments. So with microneedling and fractionated lasers, you put little microchannels in the skin. So we put the PRP over top of the skin after that to help promote healing, decrease the bleeding, decrease bruising, helps rebuild collagen and elastin, and just get better results in the end.
That's really interesting. What else can PRP be used for?
Well, we also will inject it into the skin. We did that just fairly recently. So it's been shown to increase the collagen and elastin in the skin. So it's often used anywhere in the face, anywhere in the body, really. But it's good in the tear trough area because it can help thicken the skin slightly, because that skin is so thin. If you get even minimal increased thickness in that area, it can be beneficial and help decrease those dark lines, dark circles under the eyes, and some of that creepy tissue that can form with age.
as well as hair, right?
Yeah, absolutely. PRP is pretty big for hair. So it's used for thinning hair. It's injected pretty much all over the scalp, obviously targeting the areas where the hair is thinnest. And so there's male pattern baldness, and it's commonly used in those areas, kind of the strip along the top of the head. So it's used quite frequently. It takes several treatments. It's not one treatment and you notice a change right away. It's a very gradual change, typically, like I said, about 6 treatments used, and it increases the thickness and density of the hair. And most people are pretty satisfied with the results from that.
Yeah, like I've been in the industry for a few years now, and most of the time with PRP, where I would see people having it done would either be with hair transplants or microneedling. It's very cool and interesting to see how when people pair the two together, either it's with hair or if it's with microneedling, their downtime and their recovery was way quicker than patients that did not add PRP to their overall treatment. It's nice for people who also don't want to have like anything that's a chemical or
Like
what else should I
medication.
say? Medication, because it's coming from your own body. So there's nothing like there's really no downside to doing that. So overall, PRP is used for both medical and cosmetic purposes to promote health and healing. Most of the time, we would see patients use it with hair loss or microneedling. Dr. Keys, is there any other treatments that PRP can be used for?
Yeah, I would agree. Those are probably our most common treatments that we use it for. It is an adjunct treatment typically, but it can be used on its own for other things too. So we also do joint injections for arthritis. It can be used for tendon injuries as well. So those recover or promote healing in those areas, and some lubrication in the area as well. So that's a common area where it's also used. It can be used for scars as well. So I do a lot of scar treatment here with lasers and different devices, radiofrequency microneedling, etc. So we can use it in those areas as well. And then there's sexual health injections as well. So that's the trademark names, the P shot, the O shot, the G shot, and we can maybe touch on those in another podcast episode. But that's a whole different area where it can be used for sexual health as well.
I think most of our listeners, they would understand like the term vampire facial because it was such a popular cosmetic treatment that all of this, like all celebrities were getting done. It was the picture that you would see and their face was covered in blood and you were like, what is going on? I think the most, like the one that I remember the most is Kim Kardashian. She was definitely promoting the vampire facial, and I think that's where it became so huge.
Yeah, absolutely. This has been something that's been pretty popular with celebrities and in the media. Those pictures of the blood all over the face isn't really, I wouldn't say typical. Those are either using whole blood with some red blood cells, or they're going too deep with the microneedle. So typically it's not as bad as what some people have maybe seen, but it is real, and you do get real results from it. It's not gimmicky. It's not something that they're promoting something that doesn't work. So it is a good treatment. It's something that we often use as an add-on with our treatments, as we were saying, and we like it. We like to use it here and get good results.
And because PRP uses your own blood, it's very safe with very few side effects or reactions.
Yeah, for sure. It's naturally occurring in our body, right? So yeah, there's no side effects at all. So very safe, like Shauna said.
One last thing, Dr. Keys, I've been hearing you lately talking about exosomes around the clinic. Tell our listeners about that.
Yeah, this is kind of a newer treatment that's showing some pretty good results. So exosomes come from stem cells. So right now they're typically coming from umbilical stem cells and placental stem cells. So it's not actually the stem cell itself. They're these little exosomes, and anyone that went to med school or did any of this physiology, these exosomes are just kind of expelled essentially from the cell, and they contain this these growth factors and micro and mRNA, messenger mRNA, and cytokines. And what they do is they'll go and be taken up by other cells and can actually change them. And so you can use these new, younger messaging signals, and they're taken up by these cells and allow them to function completely different. So this is something that's actually been pretty exciting. So it's been used in hair. It's also been used in joints, but it can be used for anti-aging as well. So there's many different uses for this. It's pretty exciting, and we're hoping this is something that we can start offering in our clinic whenever we're able to.
Thank you for sharing. I could hear in your voice how excited you were about telling us about that. It's such an interesting treatment.
Yeah, it's something new. It's always nice when something new comes to the market and shows some good results. So yeah, it's pretty exciting and looking forward to it for sure.
Where can we find out more information about PRP?
I guess first I would go to our website, where there's lots of information to be found there regarding treatments and uses, etc. And our website is www.keysmd.ca to learn more about it.
Perfect. And we're always open to questions. So you are more than welcome to submit a question through our website or follow us on Instagram, Keys MD Cosmetic Clinic. And we would be happy to answer any questions regarding PRP or any other treatments that we offer here. Thank you so much for joining us today. That was a very informative podcast today, Dr. Keys.
Yeah, it was good. Thank you, Shauna. And thank you all the listeners for tuning in, and looking forward to chatting again on the next podcast.
If you like what you hear, don't forget to share and subscribe so that you never miss another episode and to help us grow.